Women's Heart Health. Voices of lived experience.
My name's Trisha, I'm 52 years old. On the 20th of September 2021 my life changed. I woke up and it was a Monday morning and like I usually do, got in for a shower, needed to wash my hair. I had a wee bit of palpitations, but I didn't think anything of it. I came out of the shower and I felt really warm and I thought, I'm having a bit of a hot flush, and then from there it kind of went downhill. I started experiencing chest pain. I had a pain radiating down my left arm. I started feeling really clammy and sweaty and feeling really nauseous. I knew I was having a heart attack. It was very much genetics for me. I had both parents die at a very young age from heart disease.
I'm Donna, I'm 36. I was born with complete heart block and I was fitted with my first pacemaker at 10 days old. In 2013 I became quite unwell, what I thought was a cold. The full of 2013 I was on steroids, I was on antibiotics, I was in and out of hospital. Cardiology had said, we think it is your asthma or something going on with your pacemaker. We'll do an echo. That's when they told me, you know, you're in severe heart failure. I had a condition called LVSD. Your heart's not pumping great at all. We're really sorry, you know, it's not your asthma. Doctors thought, like, because I had grown up in and out of the hospital, that I was fine with this and I'd heard of it, and I hadn't. You know, that day in that room, I was like a rabbit in headlights, thought I was dying.
My name is Jill. I live in Edinburgh and I'm a clinical massage therapist. In 2021, I had one, probably two heart attacks. I had no idea I was having a heart attack. It was nothing like what you see in the movies. There was a ping in between my shoulder blades, very noticeable. But I could ignore it, and then 5 minutes later, intense pressure or pain on the chest. And the first time it happened, I was out of breath and breathless and didn't know what had happened, and I sat down for about 10 minutes, got my breath back, and then 2 days later, I had the same thing, but it was much more obvious. I was on my hands and knees. As the hours wore on, I felt more and more anxious. The definite feeling of impending doom that people have spoken about with heart attack. The senior A&E doctor told me that I had gastritis, which is an upset tummy. And then as I was about to leave, my blood tests came back to say that I had elevated troponin levels, and the senior A&E doctor was super apologetic and said, you have definitely had a heart attack. And they discovered that I had had a SCAD heart attack. SCAD stands for spontaneous coronary artery dissection.
Challenges after a heart event.
I just thought that my heart would be healthy because my full-time job has been physical for the last 30 years. And I just assumed that you could only have a heart attack if you had blocked arteries. Now obviously you can, but I think it psychologically affected me quite a lot because there was nothing I could have done to avoid it. If there is anything you can do to improve your heart health generally, do it.
I'm terrified. I'm so scared that it's going to happen again. I feel so weak, I feel so vulnerable, it's not like me. I thought, is this my life now? Bear in mind, before this I was extremely physically active. I was doing high intensity aerobic workouts to the point where I could hardly lift a kettle.
It's not just the heart failure you need to deal with. For me, it was other things as well. I had to be started on blood thinners. The nosebleeds were horrendous. The period bleeding, it was horrendous. I got diagnosed with a heart failure and my consultant said to me, you won't be able to have children. People need to remember, like, it's such a massive thing to be told. I had to give my job up because I couldn't do it, and the surgeon I was under at the time had said, you know, such a physical job, and that just broke me. Because I was that used to working, and you know, I loved my job and I loved working with people, and to be told that at 27, I was like, what do? I thought, I can't do anything. I can't. I'm going to do something, I'm going to die.
Reflections on women's experiences.
You know, I think women get engrossed in their families, they get engrossed in work life, they tend to be the people who hold things together, and I think we take our health for granted and we put it on the back burner. I was just constantly on the go. I didn't have time to stop and think. Looking back, for me, I might have had symptoms. I don't think I did, but I may well have. But I was too busy. If you're feeling that you've got twinges, or you're a bit breathless, or something's a bit off, please go and talk to a doctor.
There is this bias and this misconception that women don't have heart attacks. I was not believed because when I got to A&E, I was quiet. Now, people who know me will know that's not normal. But people who don't know you are like, oh, she's fine, she's just sitting there. No, you're normal. You have to listen to your body, and bear in mind that when you meet a healthcare professional, they have never met you before in your life. So it's finding a way to be able to say to whoever you meet, normally I can run 5k. There's no way I could get up the stairs right now. It just gives them a parameter.
Living well with a heart condition.
I'm doing okay, you know, there's times, good days, bad days, there's a lot I can't do on my own, I need the help, and I think you need to accept that. You learn to live your life like you control the heart failure, you learn new hobbies, you know, you just have to, and that's the way I look at things, you know, you get one life, just take it and just enjoy it and learn to live the new, I always say I've lived the new me. I've learned to live the new Donna, because I feel sometimes people just like, oh, you've got heart issues. They rule you out, and it's not true. The amount of medication and different things out there these days, it's amazing how people can live good lives. Ask for the help, don't be scared. Don't be scared to ask your cardiologist, ask your nurse, ask anybody, like, what does this mean for me? Like, am I going to have to stop X, Y, Z? Like, what can I do?
What I didn't expect and what kind of crept up on me was the mental health aspect of it. A year after my heart attack, I took a dip. I was still functioning, I was still going to work, but within the house I wasn't coping. I was still terrified inside that I was going to have a heart attack. I've been at counselling now for the best part of 9 months. I can cope, I'm not living in fear every day. Am I still reminded at times? Every day I open my cupboard and I'm taking my medicines, of course I'm reminded. But I suppose for me, living with heart disease is not a death sentence. There is a future. I go out, I socialise, I exercise, I go on holiday. So there is life after a heart attack, and there is life living with heart disease.